Well, it may not feel like it today, but spring is here in Wisconsin, and with that comes more outdoor work for families, including cutting the grass. But that could bring unexpected injuries for your kids. We're joined by Dr. Rebella this morning, an emergency medicine pediatrician with UW Health Kids in Madison. We're going to talk about lawnmower-related injuries. Dr. Rebella, good morning.
Good morning.
Well, this is something families, I feel like, usually don't think about as the warm weather approaches. Are lawnmower injuries really something you see often?
Well, you're exactly right. They might not be something that you think of because of the obvious danger. So you sort of expect people to have an awareness. But really, all it takes is for a split second and that injury can occur. And so, unfortunately, they're relatively common. The Consumer Product Safety Commission reports more than 60,000 people, including more than 9,000 children, are injured each year. And while there's a peak incidence at 16 years of age, about a third of those injuries occur in children younger than 12. And we actually see a second peak at 3 years of age. Now, of course, we all know that 3-year-olds are not using the lawnmower. So what this tells us is that many of the injuries occur not just in the actual users, but in kids who are either bystanders or passengers on the mower.
Yeah, and what kind of injuries does that include, and how do they happen?
Well, the most common injuries are deep cuts, loss of fingers and toes, eye injuries, and burns. Those very traumatic injuries, the amputations, they occur from contact with the blade. And as I mentioned before, these can happen in a split second. All it takes is one misstep, such as slipping while pushing the lawnmower, or a brief lapse of judgment, reaching down to unclog a mower, and you're going to get one of these very, very severe injuries. But injuries also occur when the mower launches a rock or some other object left in its path. You know, these mower blades, they rotate at 3,000 RPMs, which is like 200 miles an hour. So if you get struck by a missile launched at that speed, it's sort of like getting hit by a Tiger Woods tee shot.
Huh.
So it's going to cause enough force to cause injury, even from a good distance away. And
Yeah,
then burns
seriously.
are those other big injury types that we see. And this is because the running lawnmower results in an extremely hot engine, gas tank, exhaust system, and most of these are very exposed. So they can come in contact with the skin, even for a brief moment, to cause a serious burn.
Wow, yeah, that sounds very painful. So what should parents be doing to make sure their kids stay safe when they're cutting the grass?
Well, fortunately, most of these injuries are very avoidable with some common sense and following a few actionable safety rules. The American Academy of Pediatric recommends a kid should be at least 12 before using a push mower and 16 years old before using that ride-on mower. You want to make sure the mower is in good order, especially like in those push mowers. There's a backside flap there that's used to keep things from kicking back up into the user and also prevent contact with the blade if somebody should slip. Speaking of slipping, wear good shoes. It's a great idea to have eye protection on. And then clear the area to be mowed from any potential objects that could become those missiles. And remember that lawnmowers are not built for passengers. So you want to keep your little ones off your lap. Better yet, keep them in the house or well out of the way while you're getting outside to do the lawn.
Yeah, very important tips. Dr. Rebella, thank you for joining us this morning.
Thank you.